Hey, it's Dr. Amanda with Street Smile Solutions. You're about to watch a quick video about my opinion about getting wisdom teeth out in orthodontics. And again, this is just an opinion of one orthodontist, which may not be correct. So, just a clinical opinion. You should have your own opinion, do your own research, consult your own physician and your own dentist to make the right clinical decisions for you. But enjoy the show. Hey, aloha, it's Dr. Amanda with Street Smile Solutions. Greetings from Northern California. Sorry, there's gonna be a little noise in the background. I was trying to get a quiet background, but it's not happening. So let's talk about wisdom teeth, and that's the topic for today. I had someone request this, and it was actually a layperson, a friend of mine, who said, hey, I listened to your videos. I want to know the truth, Dr. Amanda. Is this whole wisdom teeth thing a load of crap? Is this big pharma, is basically what she called it, big pharma. So is this something that dentists do so that they can pass the referral to their friend who's an oral surgeon who can make more money and use the insurance? And I was actually kind of shocked by that question. I was like, whoa, that's a loaded question. Okay, so let me hit pause and I'm gonna give you my own personal opinion without trying to piss off my whole dental community. And this opinion is supplemented by research. So yes, absolutely we need oral surgeons, okay? And to be honest, my son is strongly considering doing the oral surgery program, an MD DDS program, after college. He just spent a whole year being an extern or an intern at an MD oral surgery office, and he's like super jazzed. So we have a lot of conversations about oral surgery in our house, with one general dentist, one orthodontist, and possibly one future OMFS. So it comes up, and he spent a whole year doing an internship in an MD OMFS office, and he's fantastic to ask questions for. So we have this conversation. Is it really necessary? So from an orthodontist perspective, I don't care if you get there's times when you absolutely must get your wisdom teeth out. Don't get me wrong. And I have a lot of content on this. When it starts causing trouble, be it starts causing trouble and it affects teeth from coming down, it starts causing trouble and I can't move the back teeth because they're in the way or one's getting impacted. Yeah, okay, those gotta come, right? Those gotta go. Well, what about the preventative ones? And that's what my friend was specifically asking. She goes, it seems like it's just kind of like a robot thing, like once you get to 16, 17, 18, they're like, okay, time to get your wisdom teeth out, and you just do it because you think that's what you're supposed to do because everyone did that before you, and you did it, and your parents did it, and your aunties did it, and your brothers did it. But do we really need to do that? And I said, again, loaded question, what's going to happen if you don't? And a lot of times if you don't, nothing happens. So, and that, it really just depends on you. So let's talk about the why behind it. Is it wrong? No, not at all. I mean, and if you're somebody who's worried about it at all, or, is just concerned about the chance that something's going to blow up. Yeah, things can blow up. I mean, for example, my dad never got his out. I think at like 35, 40, they started to blow up. I can't remember if it was perio or decay or what it was, but it was something. Obviously, it's very hard to get back there, so unless your hygiene is meticulous, yeah, you should get them out because they're probably going to blow up later, especially if they're not completely in occlusion, touching, teeth are meant to touch another tooth, so they need to be upright, not tipped, touching another tooth, and actually be functional to eat without like having any flaps of gum over the back that could collect plaque or bacteria. So yeah, if yours are fully erupted and you can keep them clean and cavity free and you don't have a history of having caries in your background or anything like that, great, keep them then. And sometimes you don't know if there's going to be space for them to come in. Now let's talk about orthotropics, because I really recommend you all watch the movie Open Wide. It might not be on Netflix right now. It comes, it goes. It's about the Mews, Mike and John Mew, mewing. If you know what mewing is, everyone under 18 knows what mewing is. So, but it's about that and how using your muscles and bones properly starting from infancy can help to make your jaws and oral posture and nasal breathing and tongue positioning can help your jaws grow the right width and the right position on your face. So the big problem is that the vast majority of us, and John Mew used to talk about in that movie before he passed, he talked about faces melting, and I think Mike Mew did too. That is where instead of growing forward, the faces are going down and back. And I mean, I can see melting faces everywhere I go. They're usually mouth breathing as well. I can spot them at Disneyland, melting face, melting face, melting face. Once you get to a melted face, there's not much you can do. And faces start melting by 8, 9. So yeah, sometimes you absolutely need to get teeth out because there's no space or there's a problem. But if you have proper oral posture, proper nasal breathing, proper diet, starting from infancy, there should be space for your wisdom teeth to come in. And if they don't, well, then get them out then. But, and it's really up to you because sometimes when they're stuck or not in good occlusion, they can hit the second molar in a weird position and cause resorption of those teeth or the roots or decay. So, you know, things can happen. And I always tell patients, you know, it really just depends on what type of person you are. I mean, if you think you're always going to be able to afford it, because a lot of times when you get older, sometimes insurance isn't going to cover the surgical removal of them for preventative reasons, you know, and it might cover only if there's a massive emergency, only one, not all, you know. And by then you might already have damage, and it might happen. It might blow up on you on a vacation, at work. It might be a very inconvenient time. There's a reason why everyone in the military has to get their wisdom teeth out before they go to boot camp. There's a reason for that, right? Okay, so, you know, it's really up to you. If you think that, I mean, I take a Ceph x-ray. If you take a Ceph x-ray at 8-9 along with a pano, and you get the numbers on the Ceph, and you know your jaws are in the right position relative to the cranial base, relative to each other, raise a good airway, you know, then it's pretty unlikely that something will probably happen. There probably will be space for them to come in, but also this is not just the AP or the sagittal direction of the jaws, it's also the transverse direction of the jaws. So unless you have like massive teeth, as long as your jaws are in the right position on your face and your airways in the right size, you probably will be fine. But that's pretty much all I got to say. So is it a scam? No, but it is feeding on your anxiety. So, you know, there's a reason why we might be the only country in the world, and I'm not sure how many other countries, but I don't think there's very many that get them out preventatively. And most of the world doesn't do it, and most of the world does fine not getting them out. So, do you need to have anesthesia, sedation? Absolutely not. And again, this is a conversation that we have in our house a lot, because that's how most oral surgeons make the vast majority of their money, is the sedation portion of the anesthesia. Did I let my kids have it? Nope. Sorry, if you want your wisdom teeth out, that's your choice. And I'm not paying for the sedation. You can have nitrous. And I mean, I'm sure ours is free anyways, but I know that if we went to the oral surgeon, I would never expect an oral surgeon quid pro quo to do my kids' anesthesia. So I'm sure we'd pay for that. But I mean, obviously, if you're incredibly phobic, then yeah. I mean, the oral surgeon would prefer you have anesthesia, not only for the money aspect, it does help them bring them more revenue, but also because you're easier to manage. They can do a lot more. Pack them in because you don't need all the hand holding. So, of course. So, no, I would personally never have anesthesia. So, hope that helps you. All right, thanks.